Irim, I'm going to ask you the next question, which is about public health roles and the importance of keeping safe. And the question is, what should we expect for there to be a good public health system in Newcastle? And what should we expect of our local leaders, public services and others to make sure they're doing their bit to keep us safe and enabling us to thrive? That's a really big question. So if you want to focus in a little bit, then that's absolutely fine too. I can't hear you, you have to unmute. Irim, if you could unmute, please.
Sorry. Thank you, Alison. Yes, that is a really big question. I think you can have a whole webinar on just that. I just want to answer the previous question though, because I think it's important for people to try and get or for me to share a perspective of where we're actually at in Newcastle in terms of I like to call it the damage done by the pandemic. So in June, 30,000 employees in Newcastle were on furlough. 7,100 people had access to the self-employment support scheme. We've seen a 65% increase in the number of benefits claimed in just 2 months, 9,300 in March, and that figure rose to an astonishing 15,365 in June. Newcastle may go from around 9,000 people unemployed to 20,000 people. We're developing a renewal plan. The objectives at the moment, I'm happy to share. So short term would be minimise business failure and unemployment. Medium term, we're looking at stabilising the economy and return those out of work to the workplace. And long term, looking at be the example for a post-industrial city that has adapted to climate change and maximised its strengths as a place to attract and retain talent. The emerging report, our emerging approach rather, will be discussed at the City Futures Board in October, so that's probably one to look out for in the near future. In terms of the question you've just asked me, Alison, public health, under public health, apart from COVID, you already have things like obesity, food and diet, wider determinants including housing, education and skills, your own lifestyle, infection, disease, sexual health, the list goes on and on and on. COVID will impact or has impacted all of that. And what is the responsibility of public health? Our responsibility is to make sure people live a healthy life in the city. And how do we do that with COVID is to try and make sure that we have mass participation in our COVID testing. We've introduced new testing sites. So there's one in the West End, for example, that's just recently been put there. I went to take a test there just to experience what the testing is actually like. I was pleasantly surprised how quick that was, how easy that was, and then was able to relay some of the issues with language barriers, for example, because all of the information is there in English. We're hoping to have pop-up sites on our university grounds to enable students to have immediate access to testing. And that's one of the things we've reacted to in terms of ensuring that as many people take part in the testing of COVID. Apart from that, we've piloted some schemes in widening our pavements, working with our local businesses to ensure that they not only try and provide provision for their shoppers, but also to keep their staff safe, who are obviously in a more vulnerable situation because they're working 8 to 10 hours with the general public. As well as that, to try and educate people in terms of, regardless of what the government are making us feel, and at times it feels as if the government are saying, well, we're going to have this all wrapped up by Christmas, you're fine, is to make sure people are aware that COVID is still out there, the effects are still out there, you can catch it just as quick and easy as people did back in March, today, and to carry on with those safety measures in terms of wearing the mask, washing your hands, staying away, isolating, shielding, all the rest of it. So from a public health perspective, it's really important, and it's one of our responsibilities and priorities to make sure that people are kept informed, we're communicating with them as easily and effectively as we possibly can, and that they understand, regardless of what's being told on national TV, that COVID is still here, it's still there, it's still affecting people, it's still killing people, and it's going to be around for a long time.